we realized there was people seeking care in very high cost areas. Emergency room, our urgent cares, or wellness isn't a one size shoe fits all. And we have to have a platform that's flexible and capable enough for us to be able to do the fine work Cameron does when he analyzes the data and strategically tiers our participation.
Our participants have higher utilization of preventive care services. They have more office visits every year, and they have significantly higher preventive screening compliance than non-participants.
Norton Healthcare's In Good Health program isn't just about wellness. It's a strategic imperative driven by data and a deep commitment to employee well-being. On this episode of Navigate's People First podcast, leaders Allison Ledford and Cameron Stelzig reveal how they've built a thriving, outcomes-focused culture. Learn how they're combining clinical care with personalized support.
We wanted people to have a home, have a provider where care is centralized and prevention is focused on before they're in our ED.
We do utilize, their well-being survey, the health risk assessment that they complete every year through Navigate. We utilize the biometric results and some other data sources to help identify populations that may be at more risk. And so we try to connect them with those resources.
If we said, in order to get this, we need you to do X, Y, Z. It feels punitive, so they wanted to frame it in a way, and we say we paint our stick orange. I think we took a note from WellCoA. We looked at how do you build a true culture of well-being with a small but mighty team. So we created a wellness advisory council.
If there was someone out there who maybe they're just getting started, maybe where would you start if you wanted to take a more evidence-based approach to your well-being program?
You look at your business. So if I'm a company and I'm starting wellness, kind of what's important to your company, right? What is the mission, vision, and value? And then how do I intertwine my value with what the organization feels of value? Because I feel like the more you align those things, the more push you're going to have, the more stakeholders that are going to be around the table.
Welcome, everyone, to the Navigate People First podcast. I'm your co-host, Troy Vincent, along with our Chief Technology Officer, Jeremy Knipper. Today, Jay and I are joined by our friends at Norton Healthcare from Louisville, Kentucky. And I said that right, Louisville, Kentucky. And we are digging into their employee well-being program, In Good Health. We're excited to have Cameron and Allison, two amazing leaders who are combining culture with clinical care and using data for good. This is going to be a good one, so let's get started. Allison, Cameron, welcome to the podcast.
Thank you. Thank you. Happy to be here.
Awesome, you guys. And I did say Louisville, right?
You did. It's Louisville, not Louisville.
I've been working on that and practicing over a few years. Allison, let's get started. The foundation of your program at In Good Health is very outcomes driven. Maybe help our audience understand you emphasize that evidence-based data drives all program decisions. Maybe elaborate on that, on how you identify and evaluate and implement this evidence-based program, and give the audience a foundation of where you're going in your program.
Yeah. So I love that question. We started our wellness program in 2009, Troy. So really hired to build a culture of well-being here. So we did a lot of data collection. We did a lot of benchmarking with similar industries, also not similar industries, just to understand what kind of programs they build. So we always started with evidence-based first, right? So HERO, the Health Enhancement Research Organization, WellCoA, different bodies of research, United States Preventive Task Force, since we are healthcare driven, and really looking at how we align our program to match up with those evidence-based practices, always using data and focusing on primary care relationships. So for instance, when we first started the program, we surveyed, at that time, we had 12,000 employees, 5 hospitals, maybe 4. I think we were still building Norton Brownsboro Hospital. And we asked them, right, being in healthcare, how many of you have a primary care doctor? 60% said they did not have a doctor. So when you start looking at claims data, right? So we started looking at the data before we built the program. We realized there was people seeking care in very high cost areas. Emergency room, our urgent cares, or what we call our immediate care centers, And so when we did that deep dive on our data, we realized very beginning stage, right, that if we're going to have a program, we needed and we wanted that to be centered around primary care homes. We wanted people to have a home, have a provider where care is centralized and prevention is focused on before they're in our EDs.
It's fantastic. And you touch on a point that I want to get to as well, is where you're managing a very tailored approach to 30,000 plus regionally distributed employees. That presents some unique challenges. Maybe touch on those unique challenges, how you're personalizing that, and how you're meeting those diverse needs of those folks.
So that is hard because you're right. We have grown now. We are 9 hospitals. We're growing more regionally versus, I would say, the Kentuckiana area, Kentucky and Southern Indiana. Now we're going all the way into Madison and then all the way to Kentucky and Bowling Green and Frankfurt. And so we've really looked for partners. And I'm going to highlight Navigate here, but someone, because wellness isn't a one size shoe fits all. And we have to have a platform that's flexible and capable enough for us to be able to do the fine work Cameron does when he analyzes the data and strategically tiers our participation, right? With impactability and different well-being scores, so we can target those groups to bring in what's important to that person and try to make it a more customizable, flexible program. What do you think, Cameron?
Yes, I definitely agree.
Building on the foundation of that data-driven decisions, Cameron, how are you specifically leveraging data to optimize the care and perhaps the costs associated with your program?
We definitely look at how we are spending money. So first off, as Allison mentioned, we want to look at preventive care as a focus. So we definitely look at how people are using preventive care and medication adherence. We see that our participants have higher utilization of preventive care services. They have more office visits every year, and they have significantly higher preventive screening compliance than non-participants.
Allison, I want to go to that. When we think about establishing a primary care relationship, that's a core element of your program. Maybe touch on why that's such a critical focus.
Yeah. So primary care, because, out in the community, we have teams that do biometric screenings too, and convenience is important, right? But we wanted that primary care home because they're the quarterback of healthcare. And we wanted an entry point for one of the lowest cost of care. So we wanted them to be established so that when they are sick, they aren't finding themselves in that emergency room. We built in what I would say is a true medical home, that focused care, because we've got nurse navigation at the offices. So what they're doing is looking at different care gaps. So let's say, Troy, you have diabetes and you need your eye exam, your foot exam, your A1C. They're looking at those care gaps and outreaching to those members or the patients, in this case, our employees, to close those care gaps, to come in for those A1C checks, foot exams, eye exams, making sure they're compliant. We've got licensed clinical social workers. We have behavioral health that they're looking to build in to those primary care offices as well. And then in the future, we're hoping it also includes pharmacy, because one of the questions you asked earlier was, how do you use data for decision making? When we truly look at our claims, and this was, Cameron, I want to say we did this with HR back in 2013. We looked at what people were spending on the cost of diabetes. And if they had just taken their meds, what would that cost have been? And it was actually cheaper for Norton Healthcare to make the decision to cover the cost of those diabetes medications if the member would just be compliant, because we were spending more in the emergency room because they couldn't afford their testing strips, their insulin, those types of things up front. So that was the start of our pharmacy-led medication therapy management program that we call RX for Better Health, which has been wildly successful when it comes to managing the pharmacy side of kind of those overall healthcare expenses.
Kind of piggybacking on what Allison said, we do see that our participants have fewer inpatient admissions, lower numbers of ED visits annually, and they also fill fewer scripts than non-participants. Those prescriptions typically do have a slightly higher cost, but they are utilizing the resources in the manner we would like them to.
That's a great point, Cameron. Can you talk to us about some of the other data successes you've seen? What are some nuggets? Like, you're seeing more people use their primary care physician, fewer ER admissions, less urgent care. What are some of the other cool things that take some time to brag about your successes a little bit.
Well, I mean, as you kind of mentioned, we definitely look at our claims to try to control cost, and we definitely are seeing improvements there. Looking at like the last 3 years, our total paid, so medical and RX paid per member per year for participants is trending at a much lower rate than our non-participants. So that's definitely somewhere we're kind of keep an eye on, and we like to see those successes. We also utilize the data a lot to outreach. So we want to make sure we're connecting the employees to the programming that suits them best or that they may need the most. So we do utilize, their well-being survey, the health risk assessment that they complete every year through Navigate. We utilize the biometric results from their physicals and some other data sources to help identify populations that may be at more risk for certain conditions or, may need certain support. And so we try to connect them with those resources. And so we have people on the team that can help with that. And we also utilize email, text messages, home mailers, any other outreach method we can to try to connect those employees to the resources.
If there was someone out there who maybe they're just getting started, maybe they're doing this for a little while, and you said, okay, based on what we've learned, because you're doing it at a pretty high level, where would you start if you wanted to take a more evidence-based approach to your well-being program? What are a couple nuggets that you say have been fundamental in driving your success?
Being data-driven, the data is the first step. So if you don't already have a way to obtain data that you need, a lot of the participation data, things like that, from partnering with Navigate, you all provide us with a lot of that reporting. But we also look at a lot of internal data sets. So there, you have to have data feeds from internal departments, human resources, just to figure out your eligibility and obtain just basic demographic data. And then you're also going to need to look at, other vendors and partnerships as far as what kind of data can they provide you so you can make sure you can award for points for participation and help incentivize engagement. You also got to look at how do you want to store and retain that? I mean, most of it is PHI related and sensitive. So you have to make sure you follow all federal standards and local standards for data retention and data storage. So one of the things we're moving towards on our end as we continue to grow, moving away from those flat files and trying to get more into a data mart or data warehouse. And that's actually something we're hoping to launch here soon. So we'll have some BI dashboards that sit on top of those and, provide some live data analysis at all times to where our leaders can see how the program is performing.
And Jeremy, I would add to Cameron's point, you look at your business. So if I'm a company and I'm starting wellness, kind of what I did back in 2009 was you would think, okay, what's important to your company, right? What is the mission, vision, and value? And then how do I, as a wellness or population health or HR, wherever that sits, intertwine my value with what the organization feels of value? Because I feel like the more you align those things, the more push you're going to have, the more stakeholders that are going to be around the table. And then eventually your value is going to take forth, right? And you can come up with some more metrics and things. But I think that was the biggest piece. If engagement scores were important to Norton Healthcare, I'm going to show you how people in our program are better and score better in wellness scores. I know there's been some talk too, just how do you tie more of the value of what's happening in your organization directly to well-being and people just feeling good, right? They want to move, they want to do all the things because they're taking their medication. But as a business owners, I think it's our job to try to show that together to those senior leaders.
Allison, that's a great point. And I think that with a strong foundation that you have and the data insights that are guiding your efforts, creating a culture of well-being becomes paramount. How in the world did you get a network of 350 wellness champions throughout your organization that are, promoting a culture of well-being across the system? How did you get that started? And maybe the leadership role in helping that get started as well.
So Troy, there's 8 of us, and one of the 8 is myself, and then Amy, who's over other teams. So you're right. I think we took a note from Wellcoa, and we looked at how do you build a true culture of well-being with a small but mighty team. So we created a wellness advisory council. We have senior executives. So we kind of built it from the top down, right? Because we wanted that reward and recognition to be huge. So we found a leader at each of our divisions. So for us, let's just say our hospitals system, Norton Medical Group, And we said, okay, we want you to be our wellness sponsor. And so they have different kind of criteria that they have to do every year. Part of that is recruiting 2 to 3 wellness leads. And those are usually managers or directors and above. So someone in a leadership role. And then it's their job to create wellness champions. So it's a hierarchy of this advisory council. We've done a lot of things throughout the years, but now they tally up how much they participate. And then we get back to them through different drawings, different learning opportunities. So monthly to them, we bring in different speakers and we give back to them something they learn personally and something they can take back to their teams. And with that, because it's like my president at my hospital is nominating me to be a wellness champion, they actually sign the application, right? So it's like they're committing my time to this. And then it just really took off. Don't you think, Cameron?
Yeah, definitely. Actually, I think we're over 400 since we've added a few new hospital facilities.
You guys, that's ridiculously awesome. I mean,
it's 100% needed, right? Because we can't do all this work, and they listen to them. They're their peers.
yeah, and you make a good point, Allison, too, is like, HR isn't getting many more bodies to help with things, which we continue to try to understand the impact that HR, well-being, all these things have to their culture and to productivity and to our hospital unit performance, our scores. All these things matter when it comes to how we're bringing this well-being to, how we're emphasizing well-being to our employees. You guys have done a masterful job of looking at the framing of a positive opportunity than a punitive measure when it comes to your incentives. Maybe touch on that, on how you're using specific language or strategies on conveying this in a positive framing that you guys are doing.
So we really looked at what kind of approach we wanted to take to wellness. Some people do the stick, some people do the carrot. Norton is a very feel-good organization. So if we said, in order to get this, we need you to do X, Y, Z, it feels punitive. So they wanted to frame it in a way, and we say we paint our stick orange. And so what we did was we just built in the budget through our own health premiums, right? To say, if we want to award someone, and there's an algorithm that you do that's a legal percentage of what you can give as a max tier wellness credit. We did that calculation and we were like, okay, we can give $910 a year, and you can do that in a ton of different ways, right? You could do a lifestyle spending account. You could do a donation to HRAs. You could do a premium discount, different things like that. We chose cash because cash was something you could take away or you could give at any time of the year. You don't need a life event like you would with a premium discount. You don't need to get married or divorced to take something away or for someone to pick up earning. And we really wanted it to be something they saw visibly on their paycheck every single pay period, right? Or in that rewards mall that we now do with Navigate. Not something that was like Allison pays $150 for her medical, because you forget you would have paid $185 had I not had this wellness credit. And so hence that's what we do. We do cash earnings. It's all taxable income. In the rewards mall, if someone buys something, they are taxed on that too. But it's more of that feel good message. So the first year we implemented, the premiums did go up with a very nice message that said, hey, no worries. If you participate in well-being, you get them right back down to where they were, right? So there was no inflation in rates that year when those open enrollment guides went out for benefit enrollment. And spouses do participate in the plan, Troy. So you're able to earn $910 per participant, or $18 and $20 if you cover a partner or spouse on that health plan.
With the way the program's designed, as another way to encourage participation instead of being punitive, we operate under an annual deadline. So if a participant doesn't engage enough to have that financial incentive the following year, we allow them to jump on each quarter. So as long as they start engaging in the program to certain levels, then they can actually start earning that incentive within the start of the next quarter. So again, another example of how we kind of incentivize the participation instead of being punitive.
Within the healthcare space, we're seeing approximately 20 to 25% of the population have 3+ risk factors within a population, and accounting for between 40 and 50% of the overall spend. As you guys are looking at optimizing care and costs, are there specific themes that you're doing in 2025 that you're evaluating when it comes to weight management, GLP-1 strategy? Maybe expand on that a little bit for the folks that are listening.
From a wellness standpoint, what we're looking at, Troy, we've been tasked with more of the preventative piece, right? Like before you get on a GLP-1, have you thought about da 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 da? As an organization, what we're looking at, so we do have our own retail pharmacies. We do have our own specialty pharmacy, which is the game changer. It allows us to do different types of things. We are looking at right now, you're not locked to a certain pharmacy to get your prescriptions. So GLP-1s, when we analyze the data, our pharmacy team is finding that it is actually cheaper to cover somebody on a GLP-1 than not to cover them specifically for weight loss, right? Because we're looking at that weight loss diagnosis because they're getting off other high cost drugs, right? So that's what we're seeing so far. And we'll have to watch this data, but they're getting off of high cost diabetes, potentially depression medicine. They're moving more, right? They feel better. They're happier at work. They're more productive. And so we want to take the stance that we want to keep covering these drugs because right now we're seeing great things and great results, but it is costly. So to manage that, we're looking at different ideas on closing our pharmacy to saying you must get that from a Norton Healthcare retail pharmacy. We're looking at infrastructure to start doing central fills within our pharmacy so we can expand those bandwidths a little bit more, and some infrastructure to start doing mail order. Because of course, if we could mail order drugs, that changes the whole ballgame of what we could do within our own health plan, because we still need to remember it's a cost game, but it's a compliance game. So we do not want to make our employees to where they're not going to be able to get their medication because we've made it too hard, right? Because then the cost just goes up and everything we did really didn't matter. So we're really trying to look at what does that look like? How do we work? Because we are healthcare. How do we work with our medical weight management program, provide that education with GLP-1s? That's probably one of the biggest focus. And then I would say also mental health. The number one predicted ADA disability is coming around mental health. And so how do you look at our jobs that we've got? How do we look at our programming? Do we have cognitive demands built in for job descriptions? Do we have enough preventative programming for behavioral health? All that fun stuff.
I appreciate your guys' continued evaluation of the GLP-1s and how you're aligning that with behavior change and seeing the effects in other areas other than the weight management side. Are there other stats that you're looking at when it comes to GLP-1s that you're seeing other areas to optimize care and costs?
Think about like RX for Better Health and the chronic condition management. All the success we've seen with that program is going to be similar to like GLP-1. So does that make sense? Like if you talk through how you grab data based on impactability, right? Because we know who has the biggest room for like cost savings dollars through what we call, our broker uses a word called impactability, and they tier members. And so what we've done is we realized that we were using our nurse navigators in the offices to do that outreach and realized it was 90% pharmaceutical related and they don't know pharmacy. And so where we've really had success, Troy, is using, and there are some of our employees are on 32 plus medications. So the way we strategize it is we go after those that have the highest impactability on the most amount of medications. And then our pharmacist meets and our dietitian one-on-one with these participants. One, a lot of it is, do you need all these meds? Are there generic meds that could do the same thing? Where are you filling your medications? And then let's make sure all your care gaps are closed. And we have seen so much success with that, even getting people on tier 1 medications. And in part of the program, their incentive is they don't pay for their medication. Or if they're on the highest tier, they may be brought down all the way to the lowest tier. So that's their incentive. One, their health, and then two, save money. We have lots of great results of the program. It pays for itself time and time again. And so we've continuously tried to grow that medication therapy management program.
Cameron, as the data guru and analyst of the program, when you think about how are you demonstrating the overall ROI of the program, maybe touch on a couple key points that you're seeing the evidence of the work of your well-being program.
Especially when we look at the individual programs, we look at a lot of their biometric data to see how it's changing pre and post and doing those statistical evaluations. But then a lot of it is driven by claims analysis, and it's trying to look and see how are those dollars changing? Like, are we saving money or are we spending more money to manage those conditions?
You guys use claim data to drive kind of monthly well-being topics and things like that. Maybe touch on the fact that we use claims data to drive our monthly topics and that proactive approach, because that's something pretty unique that you guys do that others don't.
We do look at those trends pretty frequently to see, are we seeing increases in certain conditions across our population? And we try to make sure there's programming available for one, especially like Allison mentioned, our mental health. We know we're going to see some increases with mental health usage. And so we want to make sure there's programs available for those employees. We definitely do look at those individual populations based on the data that we have available and do outreach to them to navigate them into those programs. But yes, we definitely do personalize it so that way they feel it's a personal communication. Hopefully that it encourages people to take that step and actually enroll or engage with whatever the program that we're offering for them.
One of the things I've said I'm particularly happy about what we do at Navigate is that we listen. And if you're going to serve folks when it comes to their health and well-being, you really do need to listen. And Jay, when you think about the data that we're seeing that really matter, if you look at our overall metrics for book of business in 2024, 9 out of 10 improved at least one biometric value in 2024. And then 7 out of 10 maintained healthy or reduced levels of their total cholesterol. That data really matters. And I know you're proud of that. And talk to that about the results of what you've seen in our book of business moving forward and how we're helping folks engage and thrive in those areas.
Well, I think what it boils down to is we're helping everyone chip away at a healthcare problem in ways that are unique to them, right? It might be someone's focus to address high risk or high cost claimants. It might be someone's focus to drive risk trends. It might be, your focus to get people to the doctor. It might be a more cultural approach as well, but they combine and blend in a powerful way. And you've got to be flexible to meet our clients who know their participants, meet them where they are. Cameron was talking about communication. We talked about wellness champions. At the end of the day, none of this is going to work unless we have high participation and high engagement rates to drive these behaviors that we've seen a lot of success doing. And I'd say to anyone out there listening, this podcast has been sort of a lesson in how to have a high engagement program. We've talked about communications, thinking about them in a way that is personalized and taking them to the next level. We've talked about wellness champions, a network of almost 400 individuals driving engagement into the program. We've talked about incentives and a strategy around that is powerful and sending the right message. And I know for a fact your leadership is highly engaged in your well-being program. I think that the results are going to come. We're going to have healthcare outcomes. We're going to have behavior change outcomes. We're going to have cultural results, and we can prove all of that. But it comes with building a program that aligns with your goals and your needs. And that's where someone like us can help out. And someone like Norton is a great example to hear how they're engaging their population.
And I love that because I also want to go back to, you have 8 individuals serving 30,000 people in one of the most highest variable opportunities to recruit, retain, and create positive work environment. How are you doing it all with 8 people?
Oh, I know, right? No, they're amazing. Amazing 8 people. But I think to your point, you're all being asked to do more with less, right? Like, how do you use technology, do your best job in the most efficient way possible? And so over time, I think because we have the culture, to your point, Troy, and it took a while, and it took a lot of, I want to say the most successful thing in my whole 16 years here has been grassroots, right? Walking the streets, going in the hospital, going at night shift and just talking to people, doing focus groups. Because to your point, once the culture's there and the buy-in's there, people, which is crazy. I've got 3 emails. So we do also a population health meeting, right? Once a year, different stakeholders come who all can pull different levels to effectuate cost savings change within our health plan and cultural well-being. And I had emails asking if they could come to that meeting next year, because it's almost to the point where it's a prestigious meeting that people really want to be at the table for. And I want to tell people it did not start that way. I used to beg and plead for people to be in these meetings. And so I think it's like once you get that culture there, people want to fill out the applications. They want to be involved because now it's a party, right? And it's fun.
And you bring great snacks. I mean, I'm just throwing it out there. They were great snacks.
Healthy snacks, right, Troy?
Healthy snacks. Exactly. I can say with confidence, you guys want a partner, not just a platform in your technology. Maybe expand on that a little bit on how we've partnered with you on data and that service first support.
Honestly, I actually came onto this team right when we were transitioning and onboarding with Navigate. So it was a good experience for me to have a few months with our previous vendor and then to also work with you all as we launched our portal with Navigate. We are very picky. We're probably not the easiest clients for you all to work with. And no matter what we asked, it seemed like, okay, well, we can try to find a way to do that. And to me, that was very nice to see. Everything from like color choices on the website to specific reporting requirements. You all have been able to work with us through every step of the way. So I don't think we could have done that without your support.
Yeah. And to those listening on there too, I think when you're looking for a partner, truly finding someone that gives you the access that you need to the data that you need, because so many people are like, oh, you can only have this view or you can't have that view, or, oh, we only do these things. And so it was really nice to sit down with someone who could also develop and is interested in growing just like you are, because things don't stop, right? The innovation's always there. The ideas are always turning. One of the most fun days I have is when you guys are in town, right? Because it's so energizing to brainstorm with like-minded people.
Well, I'll tell you, one of my best days at Navigate is when I walked into the boardroom at Norton and you guys had planned a birthday party for Kim Fisher, who is your account leader. And you guys had decorated the room and had a birthday party for the account manager of your program. When you pair the right people together, you can get some stuff done. And the care that you guys show us is something that we feel very fortunate about. So, and the fact that we can help you guys and help the 30,000 employees, at Norton Healthcare, and those 30,000 employees are helping the community of Kentucky and Indiana, and being able to really bring real good insights and well-being to people is what we're looking for. So we're grateful for you guys. We're grateful for the energy that you guys bring to what you guys do. Cameron, as you're leveraging data and you're analyzing good spend, I'm putting at my fingers a good spend on preventive care and medication compliance. Maybe touch on that, on how you're optimizing that care and costs associated with the good spend.
I do a lot of the analyses within the wellness program, but we also lean on our broker a lot, Lockton. And that's one of the areas that they really support us, is with some of the claims analysis. And a lot of what they've been able to show us over the past few years is that our participants do have higher utilization of that preventative care. They see their providers more often, and they're up on their screening compliance more than our non-participants. We see that year over year, they have fewer ED admissions or inpatient admissions, ED visits, and they actually are filling fewer scripts per year than our non-participants. We also have seen that trend over time. Just overall cost for our participants are lower than the non-participants. So this has been like the last 4 years of data, at least that I'm aware of, that we have seen that same trend.
This is what happens when you've got the right partners, people who understand your industry, bring real insights to the table, and know how to execute a program that is culturally surrounded by care. That's how I would describe the In Good Health program and what you guys are doing there. So it's effective. We love it. Cameron, Allison, one of the things that, as we're looking ahead in the future opportunities, looking at exploring connections between wellness participation and our clinical quality scores, maybe talk about that, on how we potentially are working together on that next step and looking ahead in the future opportunities with your wellbeing program.
Yeah, that's definitely an area that we want to do a little bit more analysis in, and try to see what those relationships look like. We already do that with our engagement scores. So we know that our participants have higher engagement scores than our non-participants with the organization. But I would expect to see the same thing with quality and safety metrics as well.
And again, Troy, it's going back to like, if you can align, because safety, quality, huge, right? If we can align the value of wellness with higher quality scores, it's just going to drive leaders to invest more.
It's just another variable in the well-being equation that we're trying to pursue. So we're thankful to the fact that we're going to be able to do that with you guys. But okay, so now we're to the best day ever segment, our closing segment. I love it when someone shares a good. Our team has talked about, me always wearing vests, so now we call it the best day ever. Jay, give us a good. What's been a recent experience that's been a good?
For me, I get to see a lot of graduations. My wife's a teacher. She gets invited to visit quite a few graduations, and seeing that is just sort of moving and inspiring and sad and melancholy a little bit, but also kind of fun and looking to the future. So it's a great experience to see kids year over year graduating.
Absolutely. Love it. Allison, what do you got?
Okay, guys. So I coach 10U soccer, and we are the number one in the league. We go into our tournament this weekend, seeded number one. So I'm feeling good about my kiddos. They've been really working hard this season, having a good time, and it's something fun to do after work.
Love it. Let's go, coach. Cameron, what do you got?
Well, yesterday we actually just attended a conference from the Worksite Wellness Council of Louisville, and Norton's In Good Health Wellness program actually won 2 awards. So it was nice to be part of the team and be recognized for all of our hard work. Allison was not there, but I'm sure she will be able to see the trophy soon. It was nice to receive those.
Fantastic. Congratulations, guys. My best day is that you heard Allison mention that she's a coach. She's very competitive. She's also a huge Indiana Hoosier basketball fan. And my best day ever is the fact that we have a homegrown Iowan coaching the Indiana Hoosiers. And so just, one other opportunity for the state of Iowa to get some street cred and all the wonderful things we do in basketball, to have the state of Indiana and such a storied program to reach out to our state and bring one of our homegrowns over to Bloomington to help that program get back on track. So,
I mean, look, we got Caitlin Clark. We're having all sorts of Iowa, Indiana.
We got Caitlin Clark at the Fever. We got Chad Buchanan at the Pacers. We got lots of great Indiana and Iowa things there. So, guys, thank you for being part of the People First podcast. We appreciate it. We like to show you guys how much we appreciate it we'll be sending you some Navigate vests that are really the Norton In Good Health blue, so it'll match up well. But we just want to thank you guys for all that you do for others, what you do with us, and thank you for trusting us in bringing your program to the wonderful people at Norton Health. So thanks everybody for joining us. Continue to do good things out there. We appreciate the opportunity to serve, and we'll see you later. Bye-bye.